you and the Department of Economic and Social Affairs is launching a paper on migration, urbanization, and family dimensions today. Convened this flow and sharing some insights with you a bit later. And after that, we'll also have a chance to interact with the panelists. So you'll be able to pose questions and also bring up any reflections that might come to you while listening to the speakers. Before we get there, I'd like to just share a couple of thoughts from our end. So as already mentioned, there are a couple of mega trends that are really affecting families at the moment. We have, as mentioned, urbanization, migration, climate change, and also technological rapid changes. When we look at urbanization, the theme of the event we have today is economic and territorial process. The role of the individual and social responsibility. What does this mean then for families and children in Africa? Some things we're seeing is that urban settings, the families are getting smaller relatively quickly, not only because parents have fewer children, but only because but also because the extended family that you normally find in rural settings is much less common in the urban areas. We're also seeing that the housing and food prices are becoming very expensive when families move to cities, and this of course also affects the families greatly. These impacts sound rather negative, but urbanization doesn't have to be negative if we manage it well. It may though, if we don't really manage to make it something that benefits the families, it may become an emerging humanitarian crisis, and that's why we need to act. And this is because an increasing population globally are living in urban slums and are at great risk, as I mentioned, to climate vulnerable to
Recording in progress.
exploitation, coercion, deception, and violence, and also forms of child labor and sexual exploitation and abuse. Therefore, we must make sure that these children do not experience discrimination based on their status as new arrivals in cities, that they don't face barriers when trying to access basic services, particularly education, healthcare, and child protection services. More than ever, the children in Africa need our collective efforts so that they can continue to grow in a peaceful environment and reach their full potential. I hope that this has given you some food for thought and that you will find the following sessions very fruitful. I very much look forward to engaging in the sessions to come, and I will next hand the floor over to Mrs. Grace Mwangi from Lumos Foundation to really set the scene for us. Many thanks from my end, and over to you, Grace.
Thank you so much, Manik, and good afternoon, good morning, colleagues. It's such an exciting moment to be able to discuss this very interesting topic that is covering the issues around urbanization, migration, and their impact on families. I'll request Delik to allow me share the screen. Okay, thank you so much, Delik. Kindly let me know whether you can see the screen.
Not yet, Grace.
Okay. I think it should be there now.
Yes, now we can see it.
Yeah, thank you so much. And thank you, Marik, again. I've shared a very comprehensive overview of what it means this year's on families, urbanization, and migration, which is quite important. You know, I found this thing quite interesting, and more so, it touches quite a number of issues that trying to handle, especially programmers who are working with families and children. Urbanization is one of the areas that really it poses a challenge, or at times becomes a barrier in terms of the interventions that are it's more complex to work with families in the city, considering many areas of or issues that are affected than it in a rural settings. We already know the theme, and so I'll go straight away in asking ourselves the current threats regarding migration of individuals to urban Africa, and looking at the 2020 reports, it's reported that 47% in terms of urbanization rate, approximately 7%. When you think about 47%, it's almost there's so much movement of persons from the rural settings going in the city. And Gabon had the highest urbanization rate in Africa, quite high, because it is 90%. And I thought if we have somebody from Gabon joining us today, it could be quite interesting and what is happening and how does it look to have such movements happening in a country. And then Libya and Djibouti had around 81% and 78% respectively. Again, that is quite high. But again, we find that there are also some countries in Africa that have big rural populations, that are Rwanda, Malawi, Niger, and others, and they have quite big rural populations. Again, interesting to be able to see what does that mean in countries of Rwanda, having high populations looking into the quality of life in terms of the families, whether the challenges Gabon is facing are same challenges that Luanda and other countries that have big rural populations are facing. And because of this, one of the observed challenge is that when urbanization has occurred and migration, it affects the family fabric, where children could live in a very safe environment. And there is social support in terms of the community social support. You find the city becomes a big challenge. And because of that natural component of support that is found in the communities, and it is not in the urban areas, you find now the government has to come in kind of to provide that support to happen. So those are the threats. And then the other thing that we will find when it comes to urbanization and migration, I found like it is forced migrations, because if there's no food, if there's no opportunities for employment, you are forced to move from one place to the other so that you can find employment, meaning you have not planned well, issues of accommodations, issues of daily meals are not there. So you have to survive and you have to look for a cheaper place to live. So that forced migrations leads to rapid and planned migrations, leading to overcrowding in urban areas. The country I live, I have found that some places that are, very crowded and mushrooming of areas, accommodations for persons, and they are not planned and the services are not there. So what happens when there is rapid urbanization? Socioeconomic gaps that will push families to informal settlements, as I mentioned earlier, largely illegal. There are no plans for those structures. They are unprotected, and there are no essential services. You find roads are not there. If fire breaks in such a settlement, it will spread out very fast because there are no services of maybe, to curb that fire, because there are not even access to places. So this migration, it happens so fast, and there is that rapid happening of things that again will affect the life of families within the setups. The other thing that we need to observe, because of all those things we are highlighting, observed effects on families. Rapid urbanization, forced migrations may probably, or they do have potential to bring about child neglect and abandonment, teen parents due to early sexualization, happening so much in the urban settings, domestic violence and single parenting resulting from frequent family separation, drug and substance abuse as a result of uncertainties. Hopelessness will create this a sense of there's no hope for tomorrow, and you'll find people engage in drugs and substance abuse, and then you'll find many children living and going to look for opportunities of food, going to the cities or to the urban towns. And then because of all this, there is delayed milestones in terms of child development, and then there is no that support that is happening within the family. So thinking about those challenges, we have to think what are the possible solutions in terms of programming and also policy that will help intervene or mitigate some of these issues that we have observed that are directly impacting on the family capability and the capacity. Share an example of a solution, a micro-level solution at the community level. And this is a program that has been done within a maternity hospital. And interacting with this maternity hospital that is set up in a capital city, Nairobi, you are able to see the effects of urbanization when families come to the maternity hospital. This program or this intervention focuses on engaging parents twice a week with parenting trainings, psychoeducation, and most of these parents are living in formal settlements. Apparently, where these parents are living, a sewage may be passing outside the house. So if the parent is not psychoeducated and given parenting capacity, even the health of the children will be impacted. And that again, poverty levels and all that. You see, there will be multiple other negative implications happening on the children and the families because of the environment. So this program focuses on that and is able to deal with different components or different areas of needs so that the parent has capacity to manage that environment they are living in, more so in terms of their caregiving, their children, and also their caregiving to themselves, self-care. There is also this program also does mandate a couple of parents come together to support. Yeah, we do annual celebration day, family celebration day, where we invite all the parents we interacted with throughout the year so that they can be able again to encourage each other and share gifts. One of the positive impacts of this program is that we have seen strengthened families. There is reduction of neglect and abandonment that is prone to happen in those informal settlements. And also, there are cross steps to stop children being separated from their families, either going to the streets or being separated to be put in different settings. Impact overall, every year this program reaches to over 2,000 families and it benefits that benefit from this intervention. Again, we sought to look at the macro level solution, and this is directly connecting to a policy, a macro level solution that is directly linked to a policy. And this is a parenting program that has been developed by the government. And this parenting program has developed a national parenting manual that will be able to guide practitioners, both state and non-state actors. This program developed will be able to reach all sorts of families and parents to be able to support them, to provide capacity as they provide care to children. So it is important to note a micro level program is not sufficient. We need a macro level solution that will touch the programming components and also policies that can benefit families even as they struggle in raising their children. So some of the lessons we have learned, because this parenting manual has been tested, some of the lessons that we learned, most of these children you find on the streets, you find them coming from the informal settlements, and this was occasioned by rapid urbanization or migrating from rural settings to the urban setting. During this meeting, we found only one male attended pretest. The others were women. You find the 9 male mothers were able to highlight concerns around the capability or availability of the male caregivers in support of their child rearing. And then you find these 10 parents are dealing with troubled boys that were exposed early in the urbanization or in the slum areas that were exposed to things that have made them to move away from the family or to harden. And then most of these children were below the age of 10 years. And then we also found grandparents caring for family. So I want to finish by saying that there is great hope, and let's take action for families in the urban areas so that we are able to strengthen family care system that will be able to provide support to their children. Thank you so much.
Thank you very much, Grace, for setting the scene for us. I would then invite Jennifer to take over and lead us to the panel discussion, which will be the next section of today. And you will also have possibilities to come back to Grace's presentation afterwards as well to ask any questions related to what you were just hearing. But let me invite Jenny to come in with the next session. Over to you.
Is low. Can you hear me now, guys? If you can hear me, can I see thumbs up?
I hear you well, Jenny.
Okay.
Jennifer, I'm not able to hear you though.
You can hear me, Chris, now?
No, you're not coming through. It's very, very low. I don't know if anyone else is experiencing the same.
Just give me a second, I get the mic.
Yes, Jennifer, we cannot hear you, please.
Can you hear me now?
Yes.
Okay.
Yeah, much better. Thank you.
Yes.
Now to hold the mic. So as I was saying, we can see from the presentation from Grace, we can start hearing the impact of climate change to children. We can start hearing how climate change is affecting our children. So I have an amazing panel of experts in this area, and I was supposed to give their bio, but I think it is better they speak for themselves so that they can be able to open their mouths. And so we have Mr. David Adoke from Child Eye Foundation, and he's a social worker like myself. David, just say hello.
Hello, good afternoon, everyone. I'm glad to be here and glad to share.
It's Matabo. Good morning. Good afternoon.
Yeah.
Yes.
Okay. How are you? Welcome to the panel.
Thank you so much.
And then we have Mr. Jonathan Kojo Anderson from Challenging Heights.
Yeah,
Mr.
thank
Jonathan?
you. Good morning, good afternoon from Ghana. Happy to see you all.
Thank you so much, Mr. Jonathan. So I'll just, because this is a very interesting conversation and I just want us to get into, and I'm going to start with Jonathan. Jonathan, so we've just heard what Grace has said about how parents are moving from rural areas to urban centers and how it's affecting children, okay? And those children who are living in urban centers, their parents are forced to work long hours. And if, like, I live in Nairobi, you spend 2 hours on traffic going to work, 2 hours going home. By the time you're getting home, your children are asleep. You have not seen them. You know, it's the only time you want to see them is the weekend, and you're so tired. You're waking up at 11, okay? You have like 6 hours, and then on Sunday, maybe you're going to church. You know, we don't have that time. And, you know, when you're talking about parenting and parental responsibility, it means being present and being there. So how do some of these key drivers, for example, climate change, food security, and trafficking, contribute to migrating of families, and how does this increase vulnerability of children? Jonathan?
Yeah, thank you. I've been in Nairobi with Indugo Society, and I know the conditions you're talking about were in some of the slums, and we saw how crowded the places were in terms of population density. I will speak mostly citing cases from Ghana. In terms of climate change, it's usually a weather affected situation pushing people to move in terms of changing temperature and changing rainfall patterns. And in the case of Ghana, the northern part of Ghana, that is the Savannah, Guinea and Sudan Savannah, which has grassland, there's one rainfall season. And that the rainfall is erratic, it's unreliable. So when that happens, it affects crop yields. And when crop yields are not enough in terms of quantity, then definitely farmers' incomes are affected negatively. The incomes levels fall for those who live in the northern part of Ghana. And due to that, they usually have to cope with low incomes from low farm produce. So how do they cope? They have to look for crop that resistance to low rainfall pattern that can survive the harsh weather conditions, so no rainfall. And when they don't have innovations like this from the Ministry of Agric, then they have to look for non-farming jobs. And when they have to look for non-farming jobs, where do you find these non-farming jobs? That is in the urban centers. So in the case of Ghana, spatial development has not been even like developed countries. You know, infrastructure allocation is very poor in rural areas. You don't have good schools, good hospitals. You don't have good road network. You don't have good water system. Most people in rural areas depend on nature to survive. And these people also have social vulnerabilities. So it's not only about the change in weather patterns that has affected rainfall in the savannah areas. There's people who are usually illiterate, people who have never gone to school, they don't have certificates to work in alternative jobs as teachers, as nurses, or as civil servants. So when that happens, they are illiterate, they don't have access to weather forecast information, they don't know how to utilize temperature forecast, rainfall patterns, trends over the years. Then when that happens, they have to migrate to urban centers. So they move from the northern part to central Ghana, the second city, Kumasi, or they move to the capital city where they have to go and work. When they move, they usually move with children. So we have children on the move. Sometimes you have children moving with youth or children moving with adults. And when they move to urban centers, then most times they have unplanned visits to these urban centers because they have the hope of going to look for greener pastures, looking at, okay, when I go to the city, I'll have a well-paying job. I'll have a good accommodation with good water and lighting system. I will have access to recreational facilities for my children, like a playing grounds. I will have access to nutritious meals and have access to the high quality service in the urban centers. But you know, in Africa, if you are not well paid, you can't survive in urban centers because the cost of living is high in the urban centers. In the case of Ghana, fuel prices have gone up, and it's been attributed to international factors, and the Ukraine-Russia conflict also affected food prices. So now, if you are in urban Ghana, you have to make good income to buy food to feed your family. So families who move from rural areas to urban centers usually ends up in slums, in unplanned settlement, because they can't afford the middle income houses and the high income houses for the working classes. So most times they have to go and live in slums, where they live in rickety buildings. They have, like Grace said, we have places where you don't have access to water, you don't have access to electricity, because even how the electrical connections have been done can even kill you. You don't have access to school because you have to go to a school that is nowhere resource. You don't have enough teachers. You don't have ICT facilities to teach children from poor backgrounds. So when that happens, then the families have to engage in many jobs. They have to do head porterage, have to carry goods